Moving on to chest injuries. So this is any significant injury to the chest that may lead to difficulty breathing, potentially serious or life-threatening problems. So chest injuries are an injury specifically. So we're not thinking asthma, right? We've already covered respiratory illnesses. This is that mechanism of injury. So something actually happened or took place. So when you're checking this person, this is when you're going to use the DOTS procedure. So you're going to look for any sort of deformity, open injuries, tenderness, or swelling. If there's any sort of windpipe or trachea push to one side of the neck is something that you're looking for. So does the neck have a very linear look to it, or is there an issue with that? Is there any sort of abnormal breathing? Okay, so is the respiratory rate elevated? Is the respiratory rate decreased? Okay. What is the quality of breathing like? And what is someone's posture when they're trying to breathe? After exposing the neck, right, because we want to expose at the skin and make sure that there's nothing there, is there any sort of bleeding or holes? And within that, is there bubbles or bruising that's taking place? Is there any sort of unusual noise or gurgling? And is there any sort of abnormal chest rise? Okay. Is the person guarding any sort of injury? And while exerting some pressure with your hands, do you hear any sort of cracking, crumbling sounds or any sort of depressions on the chest? And is there any pain or point tenderness along the ribs or clavicle? So this is a pretty serious issue that we can run into in the backcountry, obviously, if someone can't breathe, right? When we're thinking about those A, B, C, D, E's. So some of the things that we are looking for is any sort of bruising or discoloration, and maybe there's some that point pressure, right? Maybe there's a broken rib or some sort of swelling. That again, that person guarding the injury, or a point where it's really intense to touch it. So a very specific place rather than like a holistic all around soreness. So how do you give care? So for a simple rib fracture, so that point pain, right? You're going to apply a sling and sloth, which we talked about in our last series on when we looked at that clavicle injury, right? That you had to do for your assignment. Make sure that you're not wrapping anything around a person's chest too tightly. And then you're going to encourage the person to take as regular breaths as possible, even if it hurts. Okay, we want to make sure that the lungs stay clear of fluid, and making sure that that's especially the case when we have a long evac and we can't get the person out quickly even though we're trying. Reason for this, right, is we want to try and keep things as regular as possible, keep CO2 leaving the body, keep oxygen coming in, and making sure that we don't have that fluid buildup that we can get from shallow breathing. And then make sure that you're constantly monitoring that person's breathing and making sure that you're listening, and feeling, using dots at any other point to see if anything has decreased or improved. So there are different types of injuries. So there's the failed chest. Okay, and so that's when a segment of the rib is broken in two or more places. This is the part of the chest wall that can move opposite of the rest of the chest. So as the person inhales, their chest expands, those broken rib fractures actually go inward, and then the opposite would happen as they breathe out or exhale, and their chest shortens in diameter. Those broken ribs will actually come out. Okay, lung injuries or some sort of pneumothorax, right? So this is the air escaping the lungs and collecting in the chest. So there's a puncture to the lung itself. This could be inside the skin or outside the skin, which I'll get to in the next slide. So some sort of puncture. So right, a broken rib can cause a puncture to the lung. So you'll notice an increased trouble in breathing and then a rising level of anxiety. The person knows that something is wrong and they might even start to hyperventilate. So the inability to breathe adequately, and this can lead to death, obviously, right? When we think about our ABCDs, if a person can't breathe, they can't circulate, they can't leave, they can't survive. So this is an absolute rapid evac. To give care, you're going to take Bolte dressing to the to any sort of flailed chest. So if a person breathes, and so you're paying attention to that. If there is any sort of outside puncture, so you can actually see a hole in someone's chest. So it would look something like this. So that's going to be a rapid evac. Any sort of sucking chest wound where there's a hole in the chest, that is a absolute rapid evac. Trying to cover that up with definitely some sterile gauze, some sterile plastic, something like that to cover the wound. Okay. So paying attention to that, and what this does is this seals it, right, until you can go get out. So you will notice when calling for help, everything is go fast except for a rib fracture. So it is a rapid evac if someone has a pneumothorax or any sort of tension thorax. Okay. These are life-threatening injuries. It is a rapid evac if someone has a sustained chest injury associated with trouble breathing, right? ABCDs. It is a rapid evac if anyone has a flail chest. So again, going back to that punctured wound, okay? And then a slow, like I said, if the person has any sort of suspected rib fracture and they are able to walk out themselves, even if it is slower. If at any time things get worse, then it turns into that rapid evac.